Hello everyone and welcome to Angel's 12 channel again. Today I have a very interesting guest with me, and that is our account manager and the regional manager for Obagi UK for Middlands, Lisa. Hi Lisa.
Hi Ola, how are you?
I'm very good, thank you. Thank you very much for taking part in this with me today. I think you will bring an incredible value on answering some interesting questions about Obagi brand, and because we do receive a lot of questions from our patient about the science, about how the company has been developed, and I thought you will be the best person to ask those questions.
Well, thank you for inviting me on. It's really nice to be able to have the platform to have this conversation. So I'm looking forward to it.
Excellent. So, Lisa, could you please tell us how long Obagi has been established for in general as a company, and how long it has been in the UK?
Yes, so Obagi has been established since 1988, so over 30 years. It was developed by a cosmetic surgeon who not only wanted to perfectly prepare the skin for surgery, but really to eradicate the need for surgery altogether. And in later years, it was taken on by Health Exchange, who are the sole distributors for Obagi in the UK. And Health Exchange bring with them lots of support for their practitioners and their account holders. So we help you to propel Obagi and become knowledgeable in it, and really be able to market it to your patients in the best possible way. So with that, it means that we've got over 30 years worth of clinical data which backs up all of the research and development that we do and all the transformational results that Obagi can bring.
I just would like to add probably here from a clinician point of view that Health Exchange has been amazing in terms of the introducing direct to patient service. It works fantastically well, which actually saves clinical time when we have reduced hours, reduced staff. So that has been wonderful.
That's
And
really
Obagi has been it has been very successful for us to promote Obagi and still be able to help our patient who need continuous care.
Absolutely.
So,
They wanted to make it as simple as possible for you, and it was something we had planned for later on in the year last year, but with lockdown and everything that happened in the early part of the year, we just brought it forward for everybody. So I'm really glad it's working out for you. It's a great service.
It is indeed. Lisa, so you mentioned that Obagi has been developed by a doctor who wanted to eradicate the need for surgery. So what actually makes Obagi different from other brands? Because I know that it is very unique, and I know why, and I know for which patient Obagi would be the best solution. But I just would like you to explain to the public what makes Obagi different. What is the secret behind it?
Sure. I mean, I think that the main difference is going to be the way in which Obagi is able to work. And that's because it's a medical grade brand as opposed to a cosmetic brand. So you can't get it on the high street. It's not something you can purchase over the counter. And that's due to its medical nature. And the difference between a cosmetic brand and a medical brand is going to be the depth at which it can work. And you'll find that a lot of all cosmetic brands are tested to make sure that they're only working down to a certain depth in the skin. So they tend to work very near the surface. And that's so that they have that ability to retail to the general public across all platforms. So they can be online, in high street shops, etc. If they were medical based, then they would all have to go through medical professionals, as Obagi does. So Obagi has the ability because of its medical grade, to work at a much deeper level. And not to get too technical, but when you look at the skin and you're understanding the main skin concerns, those being maybe aging on the skin, wrinkles, laxity in the skin, pigmentation, all of those skin concerns happen at a much deeper level in the skin than you can reach just by treating the surface. So to have something of a medical grade that can work down and treat and target where it's needed really is what's required for treating things like melasma and hyperpigmentation, acne even, and anti-aging issues like skin wrinkling and skin laxity. So that's the main difference, to be honest with you. I think the other difference is because we are only available in clinics and with medical professionals, then you're going to be getting exactly the right thing for your skin, because you're being thoroughly consulted with by a medical professional.
Well, that is excellent news, and I think it is important to also receive the guidance and advice from experienced practitioner. And
Absolutely.
probably, you know, when using something at home, you're not alone. So if there is anything, you have any questions, concerned, you know that there is a point of contact, there is a person who you can get in touch and receive those advice that is much needed.
Definitely. And I mean, the reason that you decided to get Obagi into your clinic, what was your thinking behind that?
My first introduction to Obagi, it has been a long time ago, back in 2011. But I went on the course in London, and I found it's very interesting, very informative, a lot of science behind, a lot of education. I really enjoy the day. I went full of enthusiasm. And you know what, and actually nothing have happened. I was working with Obagi very slowly. I probably didn't prescribe enough to have a lot of confidence to recommend this to my patients. But then our roads came back to Obagi again. Back in 2014, we had a refresher in clinic training, and we did a little bit. But again, I think we lost a little bit of a connection because we didn't have a person of the point of contact who would regularly kind of follow up, see what we need, what support we needed. And then actually in our clinic, we don't have just Obagi. So Obagi is one of our range, but we choose very carefully in our clinic what we introduce. And I'm very proud to say we haven't brought any treatment that actually haven't worked. So we decided, a lot of our patients started to ask about Obagi a couple of years ago, and we started to look more into it. And then we met you when you came to our clinic, and we decided to train the whole team. And I think that was the key point, that it's not just the single practitioner who has the knowledge, but that is the people, excuse me, from our receptionist to our therapist to all the doctors. We have the knowledge, we're all on the same page, and patient could receive advice, and the right advice from the very beginning. Of course, our receptionist doesn't prescribe Obagi, but she can answer the questions, she can confidently give some recommendation and the past correct information to the doctor. So I think it has been very successful to us this year. And as you know, our account has completely rocketed from where we were in Obagi before and now. And it's simply because we believe product itself is very effective. So people like the product. We believe into it, and we have a right support from the company side in the presence of yourself like a manager. So it has been very successful for us.
Oh, good. I'm really glad. Yeah, you've done amazingly well this year. And just to touch on something you were talking about, it is really important for us to be in constant contact with you, but also for you to have that knowledge to be able to pass on to your patients. And I remember sitting in your reception area and having a conversation with one of your patients about Obagi and about her skin. So yeah, the fact that your receptionists and your whole team are knowledgeable on the brand is really important, because it means that your patients have a good point of call to anyone that they speak to. But as you say, it's medical professionals that will ultimately consult and prescribe in the range. I mean, we did touch on that, you know, choosing Obagi for your clinic. How do your team feel about it? They're very much involved with the brand.
Yes, so our team is very much involved in the brand, and now all our therapists trained on in-clinic treatments, which we can't wait to restart, but also they involve in consultation aspects. I think it is very important. Team education is the key, and that is why I think, because all team are on the same page, all team has the essential knowledge, we were able successfully recommend those products to our patient and actually help our patient while they can't come for face-to-face treatment. So because we are think certain condition, we wouldn't be able to achieve results without Obagi just treating them at home. We would need definitely to have in-clinic treatments, but Obagi at home system, especially certain system which transform your skin, they absolutely can be comparable with in-clinic treatment results. Absolutely.
They are transformational.
Yes, and I presume because skin products is so effective, there is a lot of clinical research and studies behind it. Could you just give us some information on that aspect, please?
Absolutely. Every product that is launched from Obagi is rigorously tested. It leaves no stone unturned. There's no detail that's too small when it comes to product formulation. And the research and development team at Obagi pours over thousands of ingredients. And each and every form of these ingredients is identified to find the best available quality, the highest quality, the best available bioform of the ingredient, and only then is it added into the product. But they don't stop there. They work further to optimize the key ingredients and the concentration, as well as the pH of the products, just so that they can be confident that every Obagi product delivers on their promise. They continue to develop and pioneer many skin advances, including being the first medical skincare brand to design their clinical research protocols to cover every skin type across the Fitzpatrick scale. So there's nobody that's left out. Obagi can be used on any skin type and any skin Fitzpatrick. And then that's all down to their research and development.
Well, that is actually quite, I think, incredible and unique that Obagi could be used on any skin type, because as we know, skin of color sometimes could be tricky to treat, and sometimes we need to be very careful and considerate which product we prescribe. So I'm very pleased that Obagi can offer a fantastic result on the darker skin types as well.
Absolutely, and it comes down to things being as efficacious as our vitamin A, for example, and the results that you get just from using that, predominantly down to the ingredients contained within, are astounding. It's almost like skin resurfacing. So our vitamin A products, particularly our retinol, is beautiful. It contains ingredients like calendula. So actually, you've used our retinol in the evening, and you don't really need to use a moisturizer afterwards, because it does the whole job for you. But you'll see a predominant difference between a medical grade vitamin A and a cosmetic grade vitamin A. So where ours differs is, as we were saying before, it works a lot deeper in the skin, so it can really target where that aging is occurring in the first place, which is much deeper in the skin than the first couple of layers of the epidermis. So really, to make a transformational difference, you need to target down in those deeper layers, and that's where Obagi vitamin A is very different to anything else that you can purchase.
Well, I'm very glad that you touch up on vitamin A, because that is what my next question would actually make vitamin A from Obagi different to other retinols. And you already answered this, but I think sometimes I feel a little bit worried when people buy even prescriptive grade vitamin A on websites like eBay, or trying to source it from other countries. And to be honest with you, I actually have witnessed myself where we have patient. So I believe it's always important to buy genuine product, and when it's
100%.
come to your well-being, healthcare, your skin, having genuine products, it's even more important, because it might be absolutely fine that you apply something, and as the best case scenario, it might not just work for you, but you will be okay. But some people might actually have a damage to their skin that will require more treatment in clinic and could be more complicated to fix. So
Yes. There's
yes,
always that
absolutely.
risk, and I think more often than not, what you're going to see is no difference whatsoever, and that's because what you're purchasing really isn't going to target the area that needs to be targeted, and that is much deeper in the skin, where a medical grade product can do that. And you're right, you know, purchasing without that professional advice is always a risk, for sure.
Yes, absolutely. So would you say, Lisa, people who considering to see the transformation in their skin, especially those who have any skin conditions like pigmentation or acne or rosacea, do would, in your opinion, do they need always to seek a medical advice, or should they try to resolve the problem by doing research themselves on the internet?
No, I would always ask a medical professional. The difference is that your medical professional has already done the training and they have that deep knowledge of the skin. They will be able to pinpoint the issue and get to a stage where we're able to resolve that issue. And if it's with topical skincare, fantastic. You know, and I know that you do a lot of treatments in the clinic. So how do you combine your skincare with something like injectables, for example, or other treatments?
So they really work hands in hands together, because it just depends. So there is a different types of patient who come to our clinic. There is a types of patient who are injectable candidates, and those types of patient who are skin and skin health candidates. But what I tend to observe over years, that when patient come for injectables, eventually they interested in skincare, because once you have achieved improvement, once you see that it's actually working, then you want to maintain it. And when you have a healthy skin, when you have a plump top, healthy, hydrated skin, with minimal lines,
Amazing.
with no pigmentation, with control breakouts, if you suffer from this problem, that is the results of injectables always look much better. And we
100%.
not offer just injectables in our clinic. We have a radio frequency, which is non-injectable option. We have a multiple facials, skin peels, medical microneedling. So skin treatments in clinic and skincare goes hand in hand together. And I wouldn't perform any medical grade in skin treatment without prepping the skin, and preparation starts from using the right skincare at home. I
Yeah,
would
I agree, and that's how it was created in the first place, as we said at the beginning.
I would say that a good health skincare regime is a good foundation for amazing results for all the treatments in clinic.
100%. You're absolutely right, and the two work really well together. And it's surprising how different a skin can look if you're just having injectables, whereas if you're having injectables and you're treating the condition of the skin, the difference is amazing, and as wonderful and transformative as injectables can be. Once you add in that next element, it just makes a world of difference.
Yeah, absolutely. Absolutely, Lisa. Well, it has been so lovely to have some of your time and promote the health of the skin to our patients. So thank you very much.
Thank you for having me. And I wanted to say congratulations to you as well for being an Obagi winner in 2020. So you've just been awarded highest growth, and you've just done phenomenally well. So congratulations to you and the whole team.
Well, thank you very much. And we're looking forward to what 2021 will bring.
Oh, well, thank you for having me. And I'm here to support you.
Thank you very much. Thank you, Lisa.